Shocker.
Out there. Hey, if you're in the middle of spring cleaning, you may want to think about sprucing up your looks as well.
Gail Anderson live in Torrance, where people are doing just that.
You look fabulous.
From the waist up. And
the waist up?
She's dancing.
What, the feet don't get any love?
Oh, no, from the head. It was the neck up, I think she said.
Hi, Gail.
You used to get my head. You know why I'm moving, right? No, it's Get Moving May. Take a look at this. Yesterday, 1st of May, we reminded you that this is Get Moving May. Do something. Walk the dog, get on a treadmill, get on a bike, do something. But here's the problem. You get all good looking from the neck down. You need the neck down to match the neck up. So that's why we're looking at something called Ultherapy. It's a non-invasive procedure. Take a look at this. No knife. Here is a before and after of a patient. Notice the jawline. We're in the offices of Dr. David Duffy here with Nurse Stephanie Cotright and Dr. Duffy to get more information about this procedure. Here's the animation. Stephanie, you call this ultrasound. Is it the kind of ultrasound they use for sports injuries? I've had a meniscus tear, and they used ultrasound on me. Is this the same sort of thing?
Similar ultrasound, just a different wavelength. We definitely don't want to go that deep when you're treating the skin, but it is definitely similar ultrasound.
And Dr. Duffy, how long will this last? Now, it's not plastic surgery. I know how modest you are about these things. You say it won't replace plastic surgery. It depends on what the patient needs and how the patient looks.
How long it lasts has a lot to do with how you take care of yourself.
Okay.
All right. If you gain a lot of weight or lose it, or you're bad about sun exposure and so on, probably 2 years under good circumstances, maybe longer. Nobody really knows yet, but different people respond in different ways.
FDA approved?
FDA approved for this, and going to be approved in the future for things like flabby tummies and flabby arms and that sort of thing, because it's kind of a platform. They're just being able to understand what you can do with this material.
No more Spanx. All right, we're going to see how this works. This is Peggy's before picture. Peggy's not a bad-looking woman. You wouldn't have to sneak up on a glass of water. No, no, no. So what we've done here to demonstrate the difference, here's Peggy's before. Peggy's right here. We're just going to show you. This is the half that's, wait, they're going to come back to us live. This is the half that's not treated. Is that right, Miss Stephanie? Dr. Duffy? Now, show us the half that has been treated. Oh, she's lifted on that side.
Her entire right side has been treated. So she has a brow lift here. We treated a little bit of her crow's feet. You want to make sure that you don't go into the periorbital rim, so you stay outside of the rim right here, and you definitely want to pull this cheek up.
Dang.
But this is what's really amazing about Ulthera, is how it puts the spring back into your skin. So if you watch when I do this to this side of her cheek, kind of just sits there, nothing really happens. But watch this. Just like a baby's butt. She has more definition. Her nasolabial fold on this side is virtually gone. And this is just day one.
Yikes. All right, here's the information. Now, again, it depends on how you look when you come in, whether you get a tune-up or you need an engine job. Again, we're looking at Ultherapy. Next hour, we're going to look at how this works with Pelivate. We talked with the doctor about that a couple weeks ago. And guys are doing this. They're hard to find because they don't want to talk about it because they look so good. But we have a gentleman who will chit-chat. More next hour. How you feeling?
Great.
Yes? Okay. You see this? KTLA exclusive. This is a memo about the Today Show. What we're showing you today, this non-invasive procedure to put the spring back in your face, spring cleaning, we're showing it to you today, 2 procedures. It won't be on the Today Show until tomorrow. We're giving it to you first. Why? Because this is the issue. Take a look. People are exercising, getting good looking from the neck down, exercising, eating right, but now you got a problem. Now the neck down does not match the neck up. So we're looking at some non-invasive procedures. Take a look at this. This is a woman before and after treatment, Stephanie Cotright, of something called Ultherapy. And what you do is put the spring back in the skin.
Exactly.
Now, here's what it will do for gentlemen, because guys are doing this too. And they don't have to be metrosexuals, guys who just want to, to look a little better. Here's the animation that shows, gives you an idea of how this works. It's ultrasound, and it gets down into what layer of skin, Miss Stephanie?
We're going to go a little bit right past the dermis, right into the connective tissues where your collagen is. And the collagen is the building blocks of your skin. So that's what makes skin look more youthful, vibrant, and gives it a little pep in its step. What Daniel had today is a little bit...
All right, hold on. Now, let's show Daniel's eyes before. Now, Daniel, you decided to do this because you were tired of looking tired.
Yes, that's it.
Okay, tired of looking tired. Now, that's before your before pictures. Now, we've done work here. She's done work on you. Now, this is the side that's not treated, correct? Got a little wrinkly thing going on under here. Sorry, Dale, okay? Now, Stephanie, show us what happened with the Ulthera and the Pelvic. Go ahead, drop the mirror.
So you can look to see that the right eye has opened somewhat, just a little bit. And this is just day one. What he'll see is a progression over the next couple of weeks and months to where he'll actually get somewhat of a brow lift here without the use of Botox or fillers. And then what we did was we layered it with something called Pelvic, which is a radio frequency device. Ulthera will treat his muscle, which will give him the lift, whereas the Pelvic will treat the skin, so it'll help that little crinkly skin that you get here, and it'll tighten it ever so much. So if you actually look at him, you can see that this eye is open more.
All right, let us give you some information. Dr. Duffy, we're learning this is the kind of thing that celebrities have been doing for a long time to look good on the red carpet. Now we civilians can get it.
Yeah, we can, and it really is a new platform. It's probably going to make a big difference for surgery in the future.
All right, and our 1 o'clock special, good for the guys, good for the gals. What about people of color? It's our 1 o'clock special. More KTLA Morning News after this. You look great. Ooh.